All right, so we're going to review the concepts of pharmacology from weeks 4 to 7. There's a lot of information in this one. Do not freak out. Here's how you need to do your notes. This is going to be very definition heavy. I need it to be definition heavy. Here's why. I need for you to understand what you're doing. You don't know what medication does what at this point. All right, so I need for you to give yourself a little bit of grace. Because here's the thing, I can talk to you about medications and I can teach you all the medications in the whole wide world that is going to make this NCLEX be very, very successful for you. However, comma, what value have I truly given you if you don't even know what the medication does? So you need to know where these medications come from. How does it perform? What does that mean? Okay, before I even tell you what type of medication it is. So I need for you to understand the big picture first and then break it down to smaller pieces. So look at it as, I don't know, I'm an American, but I'm also an American who is part French and part Native American. But that Native American has a derivative of 700 tribes, and I am but one, or a derivative of two actually, of those 700 tribes, right? So like, again, start at the biggest piece and component and break it down into smaller parts, and you'll do better off than trying to bounce around. That's why I don't get into meds a whole heck of a lot. Like I don't go, we're going to learn about Lasix. No, we're going to learn about loop diuretics. Why? Because I need for you to know that that's where Lasix belongs. And I need for you to know that it's because it innervates the loop of Henle, which is going to deploy into the kidneys, which is going to mess up your potassium rates and drop them like it's hot. Like, honestly, this is how this works. So don't worry about the med. Worry about where it comes from in the family and where that lies, because it's going to be so much easier for you to pick all this stuff up if you do it that way rather than doing it backwards. I know you just want to jump to meds and you're like, pathophysiology, organic chemistry, blah, I don't care about that. Listen, you got to, babe. Here's why. Because if you don't understand what that's going to do to the patient, then you don't understand what the expected findings are of that medication. Even if it's the first time you've ever held it in your hand, you know, hey, it's this type of medication. That means they should act da 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 da. And if they act adversely, you could save their life. That's why we need to know this stuff. Because we protect humanity. Remember that? Yeah, so let's do the pharmacology. You guys are going to do really okay. I'm joking and I'm cutting up because I need for you to know that this is going to be intimidating, all right? It's the real deal Holyfield. We're walking up in it now. Like it cannot be digressed. So, you've already gone through your first exam and you whooped it to shreds. So, we're just going to do the same with this one. It's going to be nice and calm and cool and collective. I might stop to tell you how to write your notes on this one. A lot so that you could get better organized. But other than that, get back, relax, try not to fall asleep. I know I've got that lull home. Drink coffee. I'm not going to encourage you to make it caffeinated because that's not right, but I know mine will be. So back again. Here we go, my cousins and my friends. All right, so let's talk about it. Viruses. So viruses are important because they only are inside of other living cells of like a host organism. So otherwise, it's not gonna reproduce. All right. Flora is something that's pretty common. It's basically the organisms that are laying on your skin, laying in your mouth, inside of your body. Right. We don't want to kill these guys because these are the good bugs. We call them normal flora. So very different from a virus. Pathogens. Pathogens are going to cause you infection no matter how tough you are. It's going to get you and it's going to get you good. You may or may not have symptoms that are as harsh, but you're definitely going to get it and it's definitely going to bite you in the bullet. Parasites. Those are things that have to feed off of you. So lice, leeches, would a leech be considered a parasite? I don't even know. Hang on, let's Google this up. Just because, see, I don't know everything, guys. I would think it's not. I don't know, though. Is a leech a parasite? Yes! Okay, I do know. I'm right. So I was technically wrong because I didn't realize I was right. There you go. The only time I was wrong is when I didn't know I was right. That's what my dad used to say. That's why I thought it would be funny to say it again. So yes, leeches are a parasite. Tapeworms, things of that nature. Next slide. All right, let's continue with these terms. So let's talk about penicillins. Penicillins, they are the safest along the broad spectrum drugs. So what is broad spectrum? It means I'm just going to go ahead and kind of hit everything, right? I'm not going to target anything, but I'm just going to do what we call a spray and pray, right? I'm going to go ahead and just rattle off a whole bunch of shells and then hope something takes. That's kind of how that works, all right? So what's cool about broad spectrum drugs is they are gram-negative and gram-positive organisms. Now recall, gram-negative and gram-positive organisms are reflective of your pathophysiology that you guys learned earlier. If you need an update on that, give it a quick Google. It'll let you know the difference in it. I'm not going to get into it because all we need to know is gram-negative or gram-positive. We can attribute it however we'd like in our brain, and it isn't really going to make a whole heck of a lot of difference just for the sake of understanding penicillin, all right? It does for other things, but for the sake of this, you should be good where you're at. Know that if you are allergic to penicillin, however, you are more than likely allergic to something called a cephalosporin. It's also another type of antibiotic. So you need to have those put together. Penicillins, cephalosporins, you're basically, if you're allergic to penicillin, it's probably going to be a cephalosporin issue as well. Again, gram-negative, gram-positive organisms. All right, now aminoglycosides. It's going to be a little bit different. Aminoglycosides are used against gram-negative, just gram-negative. Here's how I remember this. Aminoglycosides, it is very negative to have nephrotoxicity and ototoxicity, and that's what it's known for causing. So that's how I kind of remember it. Now we have here bactericidal and bacteriostatic. There is a difference and we need to talk about it. Bactericidal, okay, has a mechanism that kills the bacteria, whereas bacteriostatic only suppresses or slows the growth. All right, now let me explain how I remember this when I was younger, years younger when I graduated. All right, bactericidal, I think about kills bacteria, homicidal. See how that works? All right, cool. Let's do it again. Bacteriostatic. What do I think of when I think of static? I think of a static shock. I think of someone getting tased. So what is the purpose of tasing somebody? It suppresses or slows their getting up so they can continue to fight you. It slows their growth of getting up so they can come attack you. See that? Done. Fun. Hooray. All right, next slide. And now we get into the types of antibiotics. Again, we talked about broad spectrum. So they're effective against gram-negative and gram-positive because it's a broad spectrum, just like autism is a broad spectrum. You could be all over the place with it, right? Let's see, narrow spectrum. So it's the polar opposite. It's only effective against a few kinds of bacteria. Aminoglycoside antibiotics, again, used for serious gram-negative infections. Serious gram-negative infections. And remember, the side effect is serious nephrotoxicity or serious ototoxicity, which means your ears, they're not working, which is not good. Or your kidneys are blown. Also terrible things, all right? Bactericidal antibiotics kills bacteria. Homicidal kills bacteria. Got it. Perfect. Bacteriostatic, static shock, shocks you like a taser. It weakens, eventually leads to the death if it continues to shock. You cannot hang out with a taser all day long and just, chill and watch Netflix. It's not a thing. And if you did, that would be weird. All right. Empiric antibiotics. This is something that I can't identify what the bug is, but I'm going to hit it without knowing because I'm gonna basically know. So here's the thing. If I have a person who I know wipes from, this is terrible, back to front. Yes, I said it. Yes, it's disgusting. Let's make it worse. They're a lady. Okay, there, boom, done. So I know that more than likely this is going to be an E. coli bug. I'm going to throw an empiric out there expecting it to be that. I'm going to do my testing. I'm going to throw an antibiotic in them to kind of hit what I have no freaking idea what it is technically, but I'm led to believe that it would probably be this. So I'm going to hit him with that in anticipation that that report is going to come back in my favor. All right, so that's an empiric antibiotic, basically. All right, and yeah, I think we're done with this slide. And again, just hitting penicillin very quickly again. Penicillins, if you are allergic to penicillin, you're more than likely allergic to cephalosporins. That's a big piece for your NCLEX, for your HESI, for your standardized testing, whatever that looks like. It's going to be a piece that pops up with penicillin. Also, signs and symptoms of the penicillin allergy: rash, hives, laryngeal edema. In other words, your throat swells. And anaphylaxis, which is a terrible bad day because, well, you respiratory depress and everything closes up like your throat, and then I can't intubate you, and then it goes bad quickly. Other than that, everything that we've said about penicillin, I think for this level is about all we need to know right in this moment. All right, we got the beta blockers. So the beta blockers, they do a lot of things. They basically block the effect of the adrenaline dump that you can have. So it affects things like heart rate, contractility, blood pressure. All right. You should never give these medications, never give these medications to somebody with asthma or COPD or any other derivative of a respiratory condition of that nature. Okay, what happens is it makes their condition worse. Long story short, it makes it so much worse that sometimes they immediately go into like status asthmaticus, which is like the really nasty asthma attack that you never want to deal with. Ever, never, never. All right. So do not mess with those. They will cause bronchoconstriction and make it impossible for them to deal with that. All right. Also, this medication is really sketchy and it's sus, if you will, because we also have to watch things like systolic blood pressure. If it's under 100, you are not dosing that medication unless you want to write a report and freak out about your patient and make that family so daggone mad and feel like a miggity moron for the next 6 months of your life when you drive home every day. Like, seriously, it's a problem. And the only reason I go into this type of passionate behavior where I'm like throwing off all these nasty, mean things is because I've done it. Because I too was an idiot many, many moons ago. And I am no more. So allow me to help you help yourself and not do dumb things like that. Okay, in my defense, there wasn't a parameter listed, but dude, you were dumb. Molly, what were you thinking? Like, I'm pointing at myself at my own face. What were you thinking, woman? You should have known this parameter. If systolic pressure is less than 100, do not dose that medication. If your heart rate is less than 60, do not dose that medication. Why? Because then they're going to go to sleep and 45 minutes later, their heart rate's going to be 30. That's going to go bad. Not that I know. That's a lie I absolutely know because I've done it. Because remember, I was a dummy. Don't do it. Don't do it. Don't do it. Okay, next slide. All right, so let's talk about the different types of blood pressure medications. We have ACE inhibitors. ACE inhibitors, they stop the conversion of angiotensin 1 to angiotensin 2. All right, listen, if you want to know what that is, you can Google it. You're not going to get anywhere. It's going to confuse you more. If you know the movie Bill and Ted with Keanu Reeves and you know it well, then I would encourage you to watch the video on the RAS system, RAAS, where I talk about conversion of angiotensin 1 to angiotensin 2. It's like a 5-minute movie, but I do it because I use all the characters in Bill and Ted because it's just easier for me to explain it that way. So if you're familiar with that movie or willing to watch that movie for 2 hours, worth it, by the way. Super stupid, super fantastic, iconic for that time frame, if I'm quite honest. Then you can watch the 5-minute video of the RAS system, and it really breaks it down well, and it'll make you feel a little bit better. Otherwise, know what ACE inhibitors do. Adrenergic agents, they are beta blockers and alpha-2 agonists, which respond to adrenergic substances. Big words for beta blockers, alpha-2 agonists, right? We know beta blockers because we know that its purpose is to lower that blood pressure very quickly, and we also have to worry about things like systolic blood pressure and the heart rate as well. Calcium channel blockers, they relax vascular smooth muscle, and what that does is it allows the vascular smooth muscle to lower It's peripheral vascular resistance. And resistance is something that we, must have in the world, but too much resistance is always a terrible thing. So once we relax that, it has the ability to open and close appropriately. It has the ability to push appropriately without having too much pressure in there. So this is why it's important, very important to the African American community. A lot of African Americans are not able to take anything other than a calcium channel blocker. So that's really important as well. Matter of fact, it's a NCLEX type question, if I'm not mistaken. Those two correlative factors between, Black Americans or Black community in general and calcium channel blockers. Diuretics. Diuretics are meant to just get the fluid off of you, right? And the deal about getting fluid off of you is it's important because what is blood pressure other than fluid volume, right? So once we take off the fluid volume, we bring down the blood pressure essentially. Now, here, all you're required to do is understand these definitions and be prepared to sequence them in if they ask specifically, what is the purpose of, I don't know, a corticosteroid? What is the purpose of an anti-inflammatory? That type of a deal. All right, so let's talk about statins very quickly. Statins, they are most effective for lowering your LDL levels and raising your HDL levels. Why is this important? Well, heart disease kind of kills people all the time, and it's a big problem. So LDL, what does that mean? LDL is your low density lipoprotein. How do I remember what it is? Well, LDL, L for low. When you're low and down in the dumps, you just feel like death. LDL is lethal. How about that? How about let's tie it like that? And then the same goes for HDL, all right? So high density lipoprotein, H for high, it has to be 60 or higher, and H is for healthy. So when you're high in the clouds, you feel as free as a bird because you're happy. Happy, high, HDL, healthy. See? Done. Name of a common statin. Oh, atorvastatin, Lipitor. That is the most common one. And if you notice I said atorvastatin, that's an indicator that that's the type of medication. Atorvastatin, also known as Lipitor, statin. That's your suffix for that. All right, thiazide diuretics. First off, most common one is hydrochlorothiazide. There are some issues regarding thiazide diuretics that always show up as hot spots and hot points, and this will be for every class that you have from here on out. It causes hypokalemia, all right? So we need to know if they're having any signs of potassium level dropping, like cramping, like numbness, tingling, weakness, things of that nature. Cramping is usually the first one that happens though. Also, you need to do cardiac monitoring extensive because if this potassium level is too low or too high, we have a big issue on our hands, right? Obviously, if it's a higher level, the higher it becomes, the more dangerous it becomes, right? And then on the low end, we can actually get a little bit lower than we can get on the high end of things, if that makes any sense, because the high is the worst side of it, right? So just know that you have to make sure that we're supplementing them and telling them to eat high fortified potassium foods, as well as probably giving you some potassium supplement on top of it. All right, here are the hot spots with tetracyclines. Tetracyclines we talked about in our last examination. No, do not give this to a pregnant person. No. And as an addition to this, we do not give it to children under the age of 8 years. Why? Well, because their teeth get brown and then fall out of their head. I would say that's pretty significant. So make sure that when we're talking to them about these tetracyclines, that we have all of these bullet points in favor, and we're letting them know about all of this. But specifically, we need to know about the dangers of giving it to small children, to giving it to people who are pregnant, or breastfeeding, because that makes a difference as well. And then obviously all the other bullet points that are here are additionally just as important as the ones I've just mentioned. This one's pretty easy as well. Aminoglycosides. So aminoglycosides, they cause serious side effects. I think I've actually mentioned it once before. Kidney damage, damage to the ear, so nephrotoxicity, ototoxicity. Whenever you lose your hearing, you also lose your balance, and that's a big deal. Tinnitus is ringing of the ears. None of those things are fun. So these are the things that we need to keep in check with ourselves specific to aminoglycosides. All right, so fluoroquinolines are kind of a big deal. Back when COVID first started, everyone was stealing these medications because of the fact that everyone thought that it was going to cure COVID. The problem with that is these people are eating it so often that the number one side effect of these things is pretty serious. It's neuropathy and tendon rupture. So all of these people would eat this medication unnecessarily and take it away from people that actually did need it. And unfortunately, they would end up in the ER with some pretty significant symptoms. So fluoroquinolines went away really, really quick. I'd say within 2 months, they were banning it from basically anybody unless there was a medical necessity. And it had to be a very oddly specific medical necessity because you just don't play around with this medication. So again, peripheral neuropathy and tendon rupture is the biggest hot point regarding fluoroquinolines. Also know what they do, and also let them know if we are giving them a fluoroquinoline that they need to know to stop the drug. Stop it. Stop it and talk to their doc immediately if they develop joint pain or inflammation, because that is the adverse side effect we are not looking forward to. Sulfonamides, they're nasty, nasty drugs. They call them sulfa drugs, and patients will sometimes say they're allergic to them. Sometimes they're naturally allergic to them, but sometimes they'll say they're allergic to them because they just have some really, really awful side effects. They're really good though, and they're really effective, but they're really touchy. So, they can crystallize in your kidneys and cause some really nasty damage. Remember, things that are crystallized aren't pretty and smooth. They are spiky and they shred. That's never fun. So we need to increase our intake orally to 1.5 liters a day. Sulfonamide antimicrobial, that's the most common one that I can think of. They should take the full prescribed medication even if they're having some silly nausea, because that's pretty common. Let's see. Medication, antibiotics, you should not take them. Why? Because it ruins the absorption of the medication. And then basically you're taking it for nothing. You're splitting your, kidneys up potentially for no good reason. The biggest thing with this is Stevens-Johnson syndrome is directly affected and attached to the idea of sulfonamide use. So please understand that that is a serious allergic reaction. Give Stevens-Johnson syndrome a Google. Make sure you're not eating your breakfast cereal if you got a weak stomach. I'm just saying. But go ahead and give it a look so that you understand how serious this is, right? Assess the patient's allergy history so that you don't screw this up, basically. We want to make sure that we're doing everything that we can to not give this person any type of reaction, obviously, all right? Another thing with sulfonamides, it is known to cause abdominal pain and dark urine. Abdominal pain and dark urine, I don't mean like, oh, their urine's a little bit on the yellow side. No, I mean Coca-Cola Classic, okay? If you are peeing Coke, you need to go get a doctor immediately. That is a big problem. You have hepatotoxicity, and your liver's about to shut down, and we kind of need that liver. Kind of need a little bit. So make sure that you are paying attention to that piece of it. Make sure that they are educated about abdominal pain, dark urine, but make sure if you notice it that you're immediately notifying the healthcare provider. That's got to be stopped immediately, and we got to give them something else. All right, tuberculosis. Tuberculosis is a really hot spot for all examinations because remember, this is something that we could end up potentiating on a global level if we don't keep this under control. So we have to keep them in isolation. It's pretty serious stuff. Specific to medication, first-line drug therapy for that is the IRE. Well, IREP is what I call it. Know these medications go directly with tuberculosis. I don't know how you're going to do it because I'm sure there's a mnemonic that can be done. I'm looking for it. I can't find it. So make sure that you just know those directly related to INH therapy. Liver toxicity, most common with this medication. It ruins your liver. So obviously no freaking alcohol, right? You have to do liver function studies all the time. Signs of tuberculosis. Number one side effect is night sweats. Number two side effect is coughing up blood or sputum. Those are the number two hallmark signs of tuberculosis. Pretty scary stuff. Let's see. I can't see any other one that I would be most concerned with. If you were gonna like look at these and pick out the big ones, just pick out the ones I just mentioned. There's a lot more regarding tuberculosis, and as you get through your program, you're going to realize tuberculosis stacks on with a lot of other things like liver degeneration is one of them, making sure that you do your ASTs and ALTs or your liver enzymes or your liver studies. Those are always a big piece. The type of isolation that you have to use, they have to be in a negative pressure room. You have to be in a HEPA filter, like a full-on hazmat kind of COVID situation, because it's basically the same protocol. But we'll get into that when we get into med-surg. For now, what we have on this slide is important. Know the INH therapy medications for this one specifically. You're always going to need to know those because if you give them to anybody else for any other reason and they don't have this tuberculosis issue, it's gonna ruin their liver for no good reason, and that's never fun. Also, you have to watch out for quarantine situations. We don't want them around other people so that they can give it to them. You're on this therapy for 6 months, guys. 6 months. You were shredding your liver up for 6 months, so you have to be very, very careful. And again, I'm going over the same definitions that we went through in like slide 5 or 6. These hit pretty heavy, so I want to make sure that I threw in an extra slide for them just in case you lost the first slide. So here it is again, re-review it. All right, this is a medication for Alzheimer's. This is called Namenda. Watch this. Name and, all right, I need for you to look at this medication and know that if you see the words name and it's Namenda, that's for Alzheimer's, because Alzheimer's people forget what? People's names. There, that's how you remember that one. Done. All right, so memantine or memantine or Namenda, whatever you want to call it, it's used for moderate to severe confusion related to Alzheimer's. Make sure that when you're telling them about this, that they know that it's going to improve memory, awareness, and the ability to perform functions. It is not, Nikola Tesla 3 times, it is not going to stop it. It is only going to slow it, all right? They are extended release capsules a lot of times, which is really important for Alzheimer's patients because a lot of them, when you get moderate to severe, you start to lose your ability to swallow. So it's really hard to swallow a pill. However, if you just break out the little beads in this with the capsules and sprinkle it over, I don't know, pudding, applesauce, anything of that nature, then you can take your medication. It's easier. All right, CART therapy or combination antiretroviral therapy. Really important stuff used for the treatment to control HIV infection. It slows down the progression again, or sometimes, albeit, just kind of shuts it off, which is really nice. It prevents it from making copies of itself so that it cannot replicate is kind of the biggest deal. And it slows down the development of, full-blown AIDS, which is also not the most savory thing in the world to deal with, especially in the 90s. I mean, geez, that was just tough stuff. We need to make sure that they understand these medications are very important. We can actually give birth to baby, and they will not have the HIV infection because this is going to help prevent that transmission. They are very toxic to the liver, as always. No alcohol, right? It says or severely limited. Dude, no alcohol. I'm just going to go ahead and say it. Saquonavir is the most obvious choice. And again, VIR for virus. HIV is a virus. There you go. So make sure that it's necessary to have a high-calorie, high-fat meal with this medication. You're going to be photosensitive, aka the light is going to hurt you, aka the light is going to hurt your skin, aka you need to be avoiding the sun, and if you have to go outside, even to go check the mail, you better have some serious sunscreen on. This stuff is no joke. Why do we have to have high-calorie, high-fat meals? Well, because, duh, people who are going through this disease process are usually getting pretty thin and frail and fragile. Right? So we need to make sure that they're eating a really high calorie meal. Also, this medication is a little bit unsavory to you as well. So if you have a high calorie, high fat meal, a lot of times that makes it easier for the medication to digest. All right, let's talk about seizures. So we've got absent seizures or petit mal seizures, and that is when a person is kind of staring out of space. Now, I actually had these, so here's how this works. I'm literally talking, and all of a sudden, I go into tunnel vision, and I don't know what causes it. I've been this way most of my life. I remember as a kid, my dad would have to shake me or snap in front of me, and I would be there. Like, here's the thing, I'm sitting there, I could be watching TV, and all of a sudden, everything just kind of zones out. But I'm still watching TV, but it feels like my brain and my body are disconnected, and I can't really do anything about it. My brain is thinking, oh man, I'm totally in tunnel vision, but my body doesn't respond to that. So that is an absent seizure. A lot of people say that absent seizures are what they call pseudo seizures. They are not. Okay, pseudo seizures are a word that we use because we can't really describe what the heck it is, but we know that it's a neurological deficit, right? We see it a lot in autism. The problem is sometimes we call pseudo seizures to other doctors. We call them pseudo seizures, and that's our way of triggering. Hey, they're being a little belligerent about the fact that they have a seizure history. That's pretty significant. Now, a lot of these people with absent seizures, they're going to be on gabapentin. That's pretty standard. I know you guys don't know the medication. Don't worry about it right now. So that's a pretty gnarly seizure medication that causes amnesia, believe it or not, which is funny because people who have seizure also have a lot of short-term memory loss. So what are we doing here? Either we have petit mals and we're taking medications that's going to make me lose short-term memory, or the opposite, and we just lose it anyways because it keeps firing off at random and it doesn't stop. So there's that. What are you going to do with that? There's not a lot you can do with that. So you just kind of keep an eye on things. They do not lose consciousness. They're right there. They know what's going on around them. It's just a bizarre situation where you just kind of zone out. Now, that is different from a tonic-clonic seizure, which is a grand mal deal. That's kind of huge, all right? So those are whole body convulsions. People can get hurt. People can bite their tongue off. I've seen that happen. Often results in bodily injury. Yeah, I'd say biting your tongue off is bodily injury because they can't, like if they get their tongue stuck in, obviously, and they're clenching down, you could grab a pin and put it through a person's leg. And if they're having a grand mal, they're not even going to flinch because they're not even there. They're off in another world. And unfortunately, their body won't stop hurting itself, right? So those are very, very serious ones that we have to keep them monitored. We have to turn them to their side. They're going to potentially vomit. We don't want them to choke on it. We need to make sure that they're, kind of in a protective zone. I've had to put people in my lap before. Do not stick your fingers in this person's mouth. You will lose your finger to the knuckle. I can promise you, I have also seen that. People trying to stick fingers in mouths, helping somebody from a seizure. No, unless you've got a bite guard and unless that aura has come and unless they're still conscious, you are not doing anything to that person's mouth. Don't even try. That's not for your examination. That's just for common sense because instinctively, that's the first thing that we want to do as individuals, especially as nurses. Don't do it. You will get that on an examination later. That will be an exam question. I don't know when. I don't know if it's for my class or not, but you will eventually see that because that is another hot point we have to tell people because a lot of people get injured from that. Let's see. Status epilepticus, that's a big deal. Those are seizures lasting 15 to 30 minutes. They are not conscious. It is not going to go good, right? You have got to figure out how we're going to make sure that they do not lose their airway. This is the one that the cute little kid from Disney who was in, dang it, what is that show? There was one where there was a babysitter and he was one of the kids, and then there was one where The Descendants. Yeah. He was Cruella de Vil's kid, right? So that kid, he passed away. He was, in his teens. He passed away from status epilepticus. He had that seizure and he couldn't get out of it. So that was very unfortunate. If that'll help you try to memorize which is which. Let's see, phenobarbital and phenytoin, they help the seizures. You have to have labs for these medications. This can get really toxic really quick and it can cause a lot of big issues. So they are tetragenic drugs. We know about those. They cause massive birth defects. You cannot use these medications during pregnancy. Okay, period, point, paragraph. You have to use a reliable method of birth control because I'm not putting you on this medicine. So you got to figure it out. They have to have this medicine. We have to let them know, hey, listen, there's no kids to be had right now. We're going to have to plan this out later on. A lot of times we have to do a workaround where during the pregnancy we have to do heavy monitoring. We also have to kind of weigh the facts out to them and say, hey, listen, this might be like an 80% bad high risk pregnancy. You sure you want to do this? And if they say, I want to give it a go, then we go, okay, let's figure it out. We can't stop people from, trying to achieve their dreams. We just don't know what that's going to look like on the other end. So we try to be as informative as possible for them. So again, make sure that they are using reliable birth control methods so that they can prevent pregnancy. Know that it's got to be stopped if they find out they are pregnant. Know about those lab draws and know that they can cause some serious toxicity because they are teratogenic drugs. All right, overdose medications or antidote medications. Naloxone or Narcan is for opioid medications and narcotic overdoses. Fentanyl, hydromorphone, those are pretty common opioids. Those side effects are sleepiness and constipation. Anytime you have an opioid, your side effects are sleepiness and constipation. Why? Because it shuts down your brain, it shuts down your intestines. Because your brain dictates what your intestines do. Duh, that's why. So you're also going to have a decrease in pupil size. You're also going to have bradycardia. You're also going to be hypotensive. Again, all of this is a depressant, or it's meant to depress your system, to depress your central nervous system. So most definitely you're going to have those types of issues. Decreased respirations are a very, very big deal. If we get to respirations of 7-6, we have a big problem on us. So again, Narcan is going to be the answer for that. Now, we have Romazicon. So everyone's like, how in the heck am I supposed to remember which goes to what? All right, cool. See the word benzodiazepine? See the word Zicon? Okay, cool. They all have Z, so watch this. Flumazenil, Z. Romazicon, Z. All right? Benzodiazepine, Z. All of the Z medications are going to be for overdose of benzodiazepines. Just put the Z's together and go to sleep. And it's funny because also, ironically enough, Ambien, which makes you go to sleep, is a Z medication. All right, cool. And then lorazepam. All right, cool. Ativan. Perfect. Do you see how this works? All the Z's go together. Night-night. All right, acute dystonia, there's nothing cute about it. It's pretty nasty stuff. I'm just saying. Extrapyramidal symptoms are the result of these medications. That's facial grimacing. That's upward eye movements. These are unintentional. These are tics. Spasms of the tongue, the face, the neck. It causes people to arch forward. It's very, very weird to watch somebody walk in this weird stooped position. Give it a Google. It's worth it just so you understand what it means, because there are other things besides dystonia that look kind of similar to it. So I would specifically give it a Google so you can visualize it. Neuroleptic malignant syndrome. This is such a big deal. You can go from super cool to being confused. Your blood pressure is skyrocketed into the 200s, and then you got a fever on top of it. I don't have a lot of time to fix you. That's an emergency. A real big one, as a matter of fact. All right, so that's weird, but not as weird as other things like tardive dyskinesia. Now, this is different. This is sucking and smacking movements of the lips, chewing on the side of your face, involuntary movements of the body and extremities. You just kind of twitch really quick. You can tell if someone's got TD. I can tell you a lot of times, if you watch rap videos, you will see certain rappers that when they interview, they are grabbing the sides of their face, they're licking their lips like they're cute, right? It's not them being cute. It's because they've got TD, because they're taking some serious, serious stuff. And we're not going to talk about those drugs because they're not on your exam, but I'm sure you can figure it out. I'm just saying, like, you do what you do and you rap what you rap about. And there's a reason, because it's the truth. All right. And if you don't believe me, watch the TD. I'm just saying. All right. There's akathisia. That is restlessness, trouble standing still, pacing, rocking back and forth, constant motions of the feet. Now, that is different from Molly, who walks around and does all of those things because, well, she can't sit still, all right? This is a different type of constant motion of the feet. They're constantly tapping. It never, never stops, not even for a second. If I were you, they're similar enough to confuse them, and their differences aren't that different. So if I were you, I would be looking every single one of these up, and I would spend 2.5 minutes YouTubing a video of somebody in this state so that you could break it apart in your brain however you do that. All right. So, pseudo-Parkinsonism, again, there is a stoop posture, shuffling gait. See what I mean? It sounds really close to akinesia. I'm just saying. Shuffling gait, bradykinesia, and then tremors at rest. So, all of these are because of adverse side effects of medications. A lot of illegal substances will also cause some of these symptoms. So keep that in mind as well. If you have a patient and you don't have any type of toxicity and they're still having these types of behaviors that are pretty obvious, the next thing I would be asking is about drug use. Oh, this is a quick slide. Again, opioids, common side effects that you're going to have. Sleepiness and constipation. That's what it does. That's what it do. All right, cool. So OxyContin is a pretty obvious one. Norco, Percocet. Like I could do this for days. All of those are the top two signs. There are other signs. They're all over to the right. Those are less common, but let's focus on the most common because they're not going to ask you test questions about the least common. This is simple. This is just basically make sure that you understand the difference in these definitions because you're going to need to know the difference in these definitions. And I think I don't need to even talk over this slide because they're pretty easy definitions. So we're just going to let this one go. Again, loop diuretics. They are the most powerful diuretics, most definitely. So again, commonly known as loop diuretics or Lasix is the most common one. You got thiazides, you got potassium-sparing diuretics, you got thiazides, sulfonamides. All of those are nothing in comparison to loop diuretics. Lasix is your boy. There's one that's actually a little bit stronger than Lasix. You're not going to talk about it, so we're not going to talk about it. I'm not going to throw more on you. But there is one that's Bumex, which is like a strand worse than. And sometimes I put these people on Lasix drips. Like it is a continuous drip of Lasix. And these guys lose, I don't know, 7 pounds, 8 pounds, 22 pounds within, I don't know, 24, 48 hours. It's really, really cool. They come in sounding like they're swimming in their own fluids and they complain about peeing all the time, but man, they get better fast. I'm just saying. Watch your potassium levels. This stuff will take your potassium out your body so fast you can't stand it. And it's really hard to get potassium back into people when they're on a constant IV like that. So you have to constantly monitor those levels. They have to constantly take those big pills, potassium pills. You stick them in the back of your throat. They automatically dissolve. You choke. A lot of people throw up when they take them. I have to give them liquid potassium then. It's even worse because it tastes awful and it's so strong that when it hits their mouth, it's so pungent and dry, like a very dry wine, that you also get choked up on it. So what's the answer? The answer is not a potassium IV because that burns like hot coal fire. You really need to be really, really careful with this stuff. Do you see why we say so many things about Lasix and about potassium? This is why. It will cause hypokalemia. You have to take foods that are rich in potassium. Like what? Like oranges, like orange juice, like canned salmon, like bananas or apricots, dried apricots, things of that nature. Lots of dried fruits have ridiculously high amounts of potassium in there. So that's a good source as well. However, if you are taking medications that are potassium sparing, you better stay away from those, obviously. Make sure that when you educate these patients, they need to know that they need to rise slowly to prevent orthostasis or orthostatic hypotension, which is a drop in blood pressure when you stand. And for right now, that should be all we need to worry about regarding Lasix. All right, so let's talk about anti-Parkinsonian agents. Things for Parkinson's disorder, we think of Michael J. Fox, who was in Back to the Future. These medications are for people who have decreased dopamine and increased acetylcholine. You need to know that. What is dopamine and acetylcholine? I'm not going to talk about it right now. You're familiar with dopamine. We talked about it in class. Acetylcholine is a little more confusing. We will mess with it here in a bit because we're going to introduce these again for our next examination. So I'd prefer to talk to you about all of those at the same time because we're going to talk about other things like serotonin and blah, 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 blah. So just know dopamine and acetylcholine. We've mentioned acetylcholine once. I don't know if you remember. Dopamine's a big deal though. What is the medication you take? It literally is called levodopa, carbidopa. See how that works? They are MAO inhibitors, right? We're going to talk about MAOs for next exam. This is just specific to anti-Parkinsonian situations here. All right. So we need to let them know it's going to improve your fine motor coordination. We need to let them know that it is not going to cure the issue. It can't. That's not a thing. All right. So the only thing that this is going to do is it is going to improve your coordination. It is going to try to kind of slow down the process. You cannot have high protein foods with this medication because you're not going to be able to absorb it. And you have to take it 30 to 60 minutes before a meal or a snack, or it's not going to work. And you really, 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 really need for that medication to work. So I really, 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 really need for you to give it to them like you're supposed to. All right. Fermented beverages, beers, wines, cheese. Nope, that ain't happening. So it's going to mess things up. You have to watch out for tyramines, tyramine, Tyrami. Oh, never mind. It's right there. Tyramine. It can create severe hypertensive crisis. When I say severe hypertensive crisis, I mean half their body ain't moving because they're about to stroke out because they're like 225 over 120 with a mean arterial pressure. Ooh, that would be probably around the 160 range. That's tough stuff. Your gasket is so highly pressurized, something's going to pop. That's how bad that is. The goal of these medications is to delay worsening of symptoms. Delay. We're never going to fix these things, remember? As long as you got those things in mind, we should be okay. Just read the slide. And if you have any questions, just give me a text. But I think it's pretty self-explanatory. All right, listen, friends. This is my public service announcement for the day. If you have a patient that is on an antidepressant, you have to tell that patient before you do anything else, hey, listen, you are not going to potentially see any positive effects from this medication for at least 4 to 8 weeks. Here's what I always get. What am I going to do? Just sit there and be depressed for another 4 to 8 weeks? Yes, because you are chemically changing your brain. Do you want me to just hit the red button? Is that what you want me to do? Because that will not go well at all. What I need to do is I need to slowly pull away all that excess that you have that is causing these types of feelings that you have, and then slowly spoon feed you little bites and bites and bites. A lot of these antidepressants, you start off a low dose and then you taper up. Why? Because if I were to do that and hit the red button, you might go into a tailspin and decide that you've got ideation and you no longer want to live. And then you might act on that. And then I have to live the rest of my life knowing that because I was an ignorant jerk, you and your family for the rest of your life have suffered because you have been separated because I'm an idiot. All right? You need to let them know. Even when you let them know, they're still going to think, nah, whatever. I don't know what it is about the human condition. I will never understand the human condition or anything that you guys do, but here we are, right? It's weird. It's weird. I can tell you something's going to happen. You're like, let me just go try it anyways. This is why people stay depressed, unfortunately. Well, that and because they don't change their lifestyle structure and they still wallow in whatever is making them depressed. I don't understand why people do that either, but hey, here we are. Sometimes you have to, I guess. So we have to let these guys know you can't stop taking it. It's going to take forever. We're going to have to taper this medication up little by little. On top of that, I got to make sure that it's not getting too rough on you. A lot of times these things have some side effects. Any type of side effect, it's weird. Again, people will say that they need this medication because they got some severe situation they can't live without. And then they get the first side effect and they're like, I can't take these medications. I'd rather just sit around and be depressed. And that's ridiculous because nobody has to live in fear and misery like that all day, every day. So again, simple education helps with medication compliance. And I went off into a 2.5-minute tangent because this happens nearly every single time I introduce an antidepressant to a patient. Nearly every single time this happens. They will see me in 2 weeks and go, this isn't doing anything. I need something immediately. That is something that is a different type of medication. Antidepressants take a very, very, very long time. But once they get there, they're good. Once they get there, they're real good. So also encourage them with that because these guys, again, some of them do their due diligence. They keep up with what they're supposed to do. I would say I struggle with about 60% of people who take their antidepressants because they either forget to take them or they're depressed and they don't want to get up off the couch to take them. There's just there's a whole slew of problems with this. All right, I'm going to be done. All you need to know is that they take a while to get started and they should not stop taking them because it's not quote unquote doing anything. All right, so let's talk about primary and secondary hypertension. These are pretty easy. Primary hypertension means I don't freaking know how I got it. It means I have no known origin for having it. So it's primary because it's literally the only disease process you have. You see how that works? Now, if it's secondary, it means it's secondary to a condition that you already have, aka I have hypertension as a result of my significant obesity. I have hypertension because I've got serious diabetes that's uncontrolled and untreated. I got hypertension because I've got heart failure. There you go. Primary, secondary, cool. So stage 1 refers to blood pressures that are anywhere from systolic of 130 to 139 to a diastolic of 80 to 89. After that, 140 and above is considered stage 2, all right? So above 140 and above 90 systolic is stage 2. There are many more stages, just we're introducing 1 and 2 and we're going to leave it at that. So that should be a pretty easy slide to memorize and move on from. All right, I've talked a lot about antihypertensives. So again, use proper techniques. Take your blood pressure in the morning. Take your heart rate in the morning. Make sure that you're sitting down. Make sure that your feet are, on the ground. Make sure that your legs are not crossed. Make sure your jaws are not jacking because I don't want to hear you talking while I'm trying to take blood pressure. All right, all those things. Get up slowly from a lying or sitting position because you are going to crack your head wide open if you're just getting on these medications because it's going to make you dizzy. I can promise you. Stay away from alcohol. I mean, seriously, stay away from alcohol. It's dumb, especially when you're taking these types of medications because you're just asking for more orthostasis and more trouble. If your blood pressure is less than 90 systolic or your heart rate is less than 60, you're going to have to get off these medications, so you need to call your doc immediately and don't take another dose, all right? Should be taken exactly as prescribed. Should not be skipped. You better not skip a dose of this medication. Why? Because your body needs it. That's why. Do you want to stroke out? That'll be super fun. It's real cute when you can't move half of your body for the rest of your life. It's real cute when you got to have someone sit you to the side so that they can change your brief because you soiled yourself. Please take your medications. That's all I'm saying. That's all I'm saying. They should be taken in combination with lifestyle modifications, so diet, exercise regimen. Do not let these guys tell you that because they have hypertension means that they are not able to exercise because it's going to make their blood pressure higher. I do not care. That is a lie, lie, lie. You have to have exercise. The recommendation is actually 30 minutes most days. We used to say 3 times a week. Now it is most days at least 30 minutes of an aerobic exercise. You got all those things, you're going to do great. And I think we're going to move to our last slide. All right, guys, last slide. So NSAIDs. We got NSAIDs like ibuprofen, we've got naproxen, things of that nature. They have to be taken 30 minutes before you're taking any type of nicotinic acid to decrease the flushing. That's used for hyperlipidemia. Major side effect of that medication is severe flushing. So take some ibuprofen that brings down the flushing. Specific to naproxen, again, you have to take it with milk or food to prevent gastrointestinal upset. You also have to watch out for GI bleeding. There's a lot of things, gastric ulcers. So if you got blood coming out of either end, that's not a good thing. That's an indication you probably need to back off the NSAIDs. You also need to watch out for alcohol because what is it going to do? It's going to make you bleed even more. So if you decide that you want to drink and you have any type of bleeding disorder at all and you're taking these medications, if I blew in your general direction, you would probably have a big old fat bruise the size of a softball. So you got to be really careful, specifically with NSAIDs and bleeding. Also making sure that patients are educated. They have to refrain from getting around anything if they have any type of hemophilia. I would never in a million years let someone with full-blown hemophilia take this medication. If you have like a von Willebrand, which is what I have, it's kind of like It's kind of like a touch of hemophilia. Um, Taking these meds, I literally am watching everything. I'm basically covered in foam because the second I knock into, I don't know, the corner of a table or whatever, and by the way, in autism, we knock into stuff all the time and don't pay attention because we don't really feel pain like most people do. So this is the point where people wake up and they're just bruised and have no idea where it comes from. So again, severe risk if you have any type of hemophilia, severe risk if you have any GI bleeds already. It does absolutely cause these. They want you to drink milk to coat things. They want you to take it 30 minutes prior. And you can read the rest of the slide. So that is basically it. We got an exam coming up, and we're going to do our Zoom like we always do, and I predict that this is going to be a very successful exam, and we're going to continue on into the green pastures of getting out of this class. So I love you. I'm proud of you. Get it together. Take your time. Make good notes. Refer to your book if you need to. Send me a text if you need to, and happy studying.